Hi, everyone. It is my honor and privilege to introduce Dr. Akil Taher. He is a practicing medical doctor, an author, eternal optimist, explorer, adventurer, and a strong advocate for whole food, plant-based vegan lifestyle. He is a septuagenarian athlete who, after surviving a heart bypass surgery, has climbed the highest mountains, run marathons, gone skydiving, and so much more. More importantly, he has educated thousands just like yourselves to understand a way out of pain and chronic illness and disease. He believes that you eat, or what you eat, is more important, or probably the most important pillar of the 6 lifestyle medicine pillars. A philosophy leading a way of life that puts the responsibility of living a healthy life in our own hands and not in the hands of those who feel drugs and surgery are the only alternatives. Dr. Taher knows and shares through his incredible story the life-changing benefits of living a whole food, plant-based vegan lifestyle. And it's more than what you may think. He tells of his journey from a couch potato to living a life he could only have imagined. Dr. Taher wrote his book, Open Heart, which I show here. The transformational journey of a doctor who, after bypass surgery at the age of 61, ran marathons and climbed mountains. This is available on Amazon Kindle and now on Audible. So everyone, once again, it is my privilege to introduce Dr. Akil. He is a friend to not only me, but to all of us. So Akil, take it away.
Thank you so very much, Debbie. That was a very kind and a very generous introduction. I don't think I deserve all that, but having said that, so let us start today's talk, if I may. Let me first of all wish all of you a very happy, heart-healthy Awareness Month. What I'm going to do is start by exploring why heart disease is so often missed by women and dismissed by doctors. Then we shall go on a little bit about understanding the mechanics of coronary artery blockages so that you understand the difference between a heart attack and an angina. Then we shall delve into reasons of why it took so long to figure out that women were dying of heart disease at the same rate as men. This is kind of a bit of a history. It won't be on your test at the end, but it's a good topic to talk on dinner talks and otherwise. We shall then examine the vague symptoms of heart disease in women and understand how heart attack symptoms can often differ between men and women. And then discuss the impact of microvessel blockages in women causing heart attacks, small, tiny vessels in the muscle of your heart, not the blockages in your coronary, but small arteries. And then we shall go consider pregnancy-related complications that can cause an increased cardiovascular disease later on in life. And finally, we shall discuss the relationship between menopause and heart disease. So let me tell you, women are more likely to miss the warning signs of a heart attack, sometimes waiting for hours or longer before dialing 911 or going to the ER. They may not have the typical chest pain that they have seen or heard in the movies and TV, but only vague and subtle symptoms. So obviously they think that this is something else, and refuse to go to the hospital. But when women do go to the hospital, the doctors are more likely to downplay the vague symptoms and send them away home, saying it may be something else. So, to start with, I would like to point out to you that heart disease is a leading cause of death in the US and worldwide for both men and women, killing more people than all the cancers combined. But it saddens me. It makes me feel sad, and I'm shocked that the awareness among women of heart disease being the number one killer was gradually increasing till 2009. We were great. Then it was followed by a decline. And by 2019, only 44% of women recognized heart disease as a leading cause of death. That means 66% of the women in this country do not realize that heart disease is the leading cause of death. And we got to change that. So every woman who is there around here, if you can tell another 20, 30 women, we can really, really benefit and help these women. That's my first take home message. Then let us understand. Well, we're talking about the heart. What is your heart? Is the size of your heart is the size of your fist. Each day the heart beats 100,000 times and pumps 2 gallons of rich oxygenated blood to every tissue and organ in your body. Through what? Through millions of miles of arteries that are in your body. So if you look at it in a 75-year lifetime, take from me, I'm 75. So my heart has already beaten more than 2.5 billion times. So we need to protect this little jewel, right? So how do we protect this heart? It's the coronary arteries, the right coronary, the left one which goes down, and the one which goes behind the circumflex. They're called coronaries because they crown the heart. Now, if you look at it, this one, LAD, left anterior descending, is called a widow maker. Why? Because it kills men and women become widows. Our understanding was for the longest period of time, we thought that heart disease is a man's disease, not a woman's disease. But think about it, folks. In 2020, 315,000 women died of coronary artery disease. That is 1 in 5 deaths. 16% of the women aged 20 and above have some sort of coronary artery disease. So, folks, this is a second message. It should not be called only the widow maker, but a widower maker. A woman can die and leave her spouse being a widower. Now, a quick understanding about heart disease, understanding the mechanics of coronary artery blockages. To be very honest, this is common to both men and women. Okay, so let's first figure this out. This is the cross section of your coronary artery. Okay, and it's not rocket science. This is your endothelium, and this endothelium produces a very powerful substance, nitric oxide, which keeps the coronary artery dilated, the blood flowing smoothly into the lumen, and it protects the wall of the artery so that it is nice and supple and elastic and doesn't get hardened on later on, so that you have blood pressure beyond that. It prevents the blood pressure. But folks, what happens when you eat a rich, unhealthy diet? The standard American diet, so-called the sad diet, your bacon, your fried chicken, your French fries soaked in oil, your donuts, your burgers. Look at this. Or for that matter, a junk food vegan or vegetarian diet like we Indians do. You have the dairy, the sugar, the creams, the paneer. Paneer is the Indian cheese, by the way. And the trans fats, which is not here, but in India it is still allowed. And then you have the ghee. Ghee is clarified butter. It increases oxidized cholesterol 10 times more than regular oil. So what happens when you have a diet like this? It damages your endothelium. You know that thing that produces nitric oxide. So your nitric oxide levels drop, and now are the bad actors which are lying in the shadows, the so-called calcium, fibrin, cholesterol, forming gooey stuff, plaques that are formed in your coronary artery. So what happens? It narrows the lumen and reduces the blood flow. And when it reduces the blood flow to an extent that you have chest pain on exertion, we doctors call it angina. Now, let me give you an example. This plaques takes decades to form. The new blood vessels, collaterals are actually forming. Here is your blockage. Here are the new blood vessels, which go beyond the blockage to supply blood to the heart. So these collaterals keeps blood flowing into the heart, never devoid of total blood flow, and very little chance of getting a heart attack. On the contrary, if you're talking about a heart attack, this is different from the angina I'm talking about. Here they are young, friable, soft clots which rupture, forming a moving clot or an emboli, causing sudden blockage to a certain part of the heart. And this, folks, is a heart attack where 50% die with the first heart attack. So what happens? You go to the emergency room, they do your EKG, they do your blood work, and they find you're having a heart attack. You're taken to the cath lab, and clots are removed, boom, 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 and then stents are put in. And if the stents fail, bypass surgery. This is the right way to go. But when you have angina, like I'll make a very profound statement now, and I don't want you all talk to your cardiologist. But had I known what I know now, had I known then what I know and understand now, I would I would have looked at other options. Why? Because my arteries were 98 to 99% blocked, but I did not get a heart attack. So if you have a whole food plant-based SOS, no sugar, oil, or salt, this reverses. Again, I'm not asking you to do that. I'm asking you to ask your cardiologist, is there another option if you're having angina? For heart attack, this is a treatment. Okay, so we go on to the two diseases that are there in women. More women die, that is, two diseases are what? Your cancer of the breast and your heart disease. More women die of coronary artery disease compared to breast cancer at all stages, 15 to 24 or 65 and above, and everything in between. This is not to undermine breast cancer, folks, but we have to be as good as breast cancer awareness campaign to address this issue. So think about it. We can always know of someone, often a young woman, who has been impacted with breast cancer. But we often can't think of a young woman who has heart disease. Why? Because heart attacks kill people very quickly. So the first time a heart attack strikes in women, half of the time they die, 50%. There is no opportunity to say your last goodbyes, no opportunity to take her to the chemotherapy like in breast cancer, no opportunity to help her pick out a wig, because it kills. And therefore, breast cancer mortality is down to 4%. And that is the 45 years that women are getting up in arms, talking about breast cancer awareness and campaigning that something should be done. Our first ladies, Betty Ford and Nancy Reagan, stood up and said, I'm a breast cancer survivor, and it was okay to talk about it. And then the physicians went to work. We have done the research. We have effective therapies now. Women are living longer than ever for breast cancer. This has to happen in heart disease. And this is the time, and it's time right now. Why did it take so long? This is the history part of it. Why did it take so long to figure out that women were dying at the same rate as men of heart disease? Look at the graph, okay? Way back in 50s, 60s, and 70s, as I said before, that it was a man's disease. That was what we were taught in medical school in the 70s. And that was written in all our textbooks. So here you see the graph. The blue line is the man's mortality, and the red one is a women's mortality. So here you find, beginning in 50s, 60s, and 70s, more men were dying because they were not recognized. But then something happened in mid 1980s. In 1983 and 84, more and more women, 2 to 3 or 4 times, are dying of heart disease than men, and that the male mortality was coming down, 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 but the female mortality was going up, and the gap was widening. So what this suggested at the national level was that the diagnostic and therapeutic strategies developed in men, for men, and by men for the last 50 years worked pretty well in men, but weren't working so well for women. This was a big wake-up call at the national level in the 1980s. And therefore, folks, we owe an incredible debt of gratitude to these two women, Barbara Streisand over here and Dr. Bernardine Healy. Is Barbara depicted in one of her amazing movies? I don't know how many of you all have seen it, Yentl, where she portrayed a young woman who wanted an education. She wanted to study Talmud, that is your Jewish law. And so how did she get the education then? She had to impersonate a man. She had to look like a man. She had to make other people believe that she looked like a man so that she could have the same rights that men had. Around at the same time in the 80s, Dr. Bernardine Healy, a cardiologist, noticed that more women were dying of heart disease. She wrote an article in the New England Journal of Medicine calling it the Yentl syndrome. She pointed out that more and more women were dying of heart disease 2 or 3 or 4 more times than men. Mortality was going down, was not going down for women, it was going up. And she questioned and hypothesized, is this a Yentl syndrome? In fact, it was Barbara Streisand's directorial debut, and it's a beautiful movie. So that is the history of how it happened. And so now we come across a heart attack, what I call a typical Hollywood or a Bollywood type of heart attack, which can happen in men and women. It's a squeezing that chest with excruciating chest pain, like an elephant sitting on your chest, or a feeling of balloon about to burst with dizziness and sweating. This is your typical. And this is what is depicted in most of the movies and TV shows. But folks, here is the most important thing. In 60% of women, the signs and symptoms of heart disease may be very subtle and vague, unlike in women. Unlike in men, sorry. If you have in men the sweating, the classical chest pain, and the heartburn, but look at women over here: jaw pain, shortness of breath, chest discomfort, not pain, and tightness, backache, upper backache, extreme fatigue, and nausea. So I want you to picture what I'm going to show you, etch it in your mind so that you understand and remember this. Look at this woman, extreme fatigue as if she had run a marathon, a woman with shortness of breath, without having any asthma or reactive airway disease or allergies, jaw pain, everything else was ruled out, neck pain, upper back pain, constant nagging feeling, and finally, shoulder pain. So what happens? More than half of women who have a heart attack don't recognize the symptoms I just showed you. People have this idea of the Hollywood heart attack. So when people don't have the classical symptoms that they've seen or heard, they think, well, this must be something else. Now, on the same grounds, folks, do not run to the emergency room or your doctor if you're having back pain or shoulder pain. There's a difference. What is that? Do not ignore out of the blue issues. The take-home message is to pay attention to change in patterns in your body. No one knows your body better than you do. For example, if you're prone to indigestion and eat in a spicy meal and you get a burning feeling in your chest, it's most likely heartburn. But if it comes out of the blue, you never had a problem before, and the symptoms get worse, especially as you walk or you exercise, that's the real warning sign that it's not gastrointestinal. Same way with the backache or a shoulder pain. You can do some stretching muscle exercises, take some anti-inflammatories, and do some warm soaks. And if it gets better, it's your muscles. So what happens is, if I have seen a patient who was sent to dentist after dentist with a toothache, nobody could say her teeth were normal. Ultimately, we found that she had a heart disease. Number two, women are more prone to silent heart attacks, where they truly experience no symptoms, understated or otherwise, when they have a heart attack. Especially these are diabetic women who have nerve issues that interfere with pain signals called neuropathy. And they are at a high risk of having a literally silent heart attack. Next, even if a doctor thinks a woman is having a heart attack, the event may not show up on a standard test that looks for proteins in the blood called troponins. They're released when your heart muscle is damaged. The heart attack screening tool is not as specific in women as it is in men. Why? You come back to the same thing. Because women generally have lower baseline levels of troponin than men. And the threshold levels set for diagnosing a heart attack were initially based on studies predominantly involving, you guessed it, men. Now there are more sensitive troponin levels are currently being used in the UK and some places in centers in US. Having one of these tests, more sensitive one, its research shows that it boosted women's odds of getting a heart attack diagnosis by 42%. And finally, folks, there is a huge difference in how men and women are treated following a heart attack. As many studies have over the years shown, they're less likely to get stents or clot bursting therapy or stents, or they're less likely to be sent for rehab. So, just to give you a short this thing, let's describe a man's heart attack and a woman's heart attack. A man's heart attack is the lower one. Uh, that way, horrible chest pain, EKG goes berserk. So the doctors see a huge abnormal EKG. There's a big clot in the middle of the artery, and they go up to the cath lab and remove the clot. That's a man's heart attack. Men usually explode, not only in this and other things in life. What happens to women? They have a whole bunch of women having this kind where it erodes. It doesn't completely fill the clot. Symptoms are subtle. EKG findings are different. Female pattern. And so, what do you think happens to these girls? They're often not recognized. I'm not sure what it must be. Might have been gas, and they're sent away home. So, we come to the first part of what is more common in women is a coronary vasospasm. A sudden spasm of the coronary artery reduces blood supply to the heart, causing chest pain and other symptoms similarly to an heart attack. More common in women folks. How can it happen? During transition from sleep to waking, episode of stress and anxiety, when you're hyperventilating, it can be triggered by cold weather, legal and illegal drugs, such as you have fentanyl, cocaine, amphetamine. In a relatively healthy individual, a single episode of coronary vasospasm does not have long-term consequences. In coronary artery vasospasm, the angiogram can look completely normal. Because you're not having the spasm and you go and get your angiogram done, it'll be normal. Now, remember, folks, to stop the vasospasm, doctors will use the dilators. But the cornerstone of all this, what I'm going to talk about, is a whole food plant-based diet. This can really prevent you from getting these vasospasms. Now, a very interesting thing now we talk about is how can women have heart attacks without having any blocked coronary arteries? The big ones I showed you initially. Because it does not affect the coronary arteries. These are your coronary arteries. What it affects is the smaller blood vessels which branch out from the coronary arteries. These are the so-called small microvessels. They're tiny arteries, and they carry oxygenated blood to the heart muscles. These small vessels, tiny vessels, constrict, get blocked. They're too small to be seen by standard testing like angiogram that only sees larger coronaries. So what do you do? Proper testing is coronary reactive testing. I repeat, coronary reactive testing. It lasts for about 60 to 90 minutes. The doctors first measure your flow, blood flow to the heart, and then inject a drug that makes your arteries, these arteries dilate, small ones. If the blood flow does not rise after that, most likely you have a microvascular disease. Treatment again, whole food plant-based diet. Who should get tested for coronary microvascular dysfunction by this coronary reactive testing? This is for people who have a positive stress test. A stress test either by running or by chemical stress test. What does stress test do? It shows that some part of your heart muscle is not getting enough blood. That's all. Then you go to the gold standard, is your angiogram to see your coronary arteries. Would you find your coronary arteries are okay? Or they're less than 50% blockage, so you can't see it. So if you have got a positive stress test and a negative coronary artery angiogram, but you're still having persistent shortness of breath, chest pain, or chest discomfort, then you should go in for this coronary reactive testing. Conditions that increase a person's risk of having coronary small vessel blockage are high blood pressure, diabetes, cholesterol high, smoking, autoimmune disease, prior breast cancer treatment, as well as other unknown factors. Broken heart syndrome, again, small vessels, is mostly found in women 50 to 70 years old that causes a condition that can cause rapid but reversible heart muscle weakness, totally reversible. It can be caused by emotional or physical stress. Emotion may be your anger, sudden surprise, stroke, difficulty in breathing, and physical, of course, can be all this stroke and seizure, and emotion can be your extreme anger and other things. It can mimic symptoms of heart attack, chest pain, shortness of breath, and sweating. Why? See, when you are stressed, when you're suddenly stressed, like we talked about emotional and physical, what happens? Your body produces hormones like your epinephrine and non-epinephrine. Heart muscle can be overwhelmed by a massive amount of epi, causing narrowing of the small arteries, small ones that supply heart muscle with blood, causing a temporary decrease of blood flow to the heart. Again, whole food, plant-based SOS diet will prevent you. So we come to complications during pregnancy that are associated with increased cardiovascular risk. You have hypertensive-related conditions, preeclampsia, 8% of all pregnancies when you get this. Then in that you get your blood pressure increase, your swelling, and your protein in the urine. You get gestational high blood pressure, which occurs later and resolves, mark my words, resolves after 2 weeks after pregnancy. Gestational diabetes in pregnancy, 4% of all pregnancies resolves 6 weeks after delivery. So what happens? When it is resolved, women think they're free. But no, these women need to be monitored as they are more likely to get cardiovascular disease in future. They've actually found clues that a damaged placenta in these cases, which shows a cardiovascular disease a decade later. Similarly with preterm and stillbirths, prior pregnancy complications, polycystic ovarian syndrome that can cause obesity, high blood pressure, high androgen, insulin, all that, So, and then you should remember, even at that time, birth control pills can cause blood clots, which can lead to heart attacks or strokes, particularly in women over 35 years who smoke and have a high blood pressure. So we come across to menopause. In menopause, your levels of estrogen go down. Hot flashes and night sweats and sleep disturbances are going to be the symptoms perimenopausal. There is an increased risk of developing disease of those small blood vessels in menopause. There is increase of metabolic syndrome in menopause, where your abdominal fat, visceral fat, which is directly related to the heart, your good cholesterol goes down, your triglycerides go up, your blood pressure goes up, and your blood sugar goes up, and you have depression. Also, lately I've learned that menopausal women have increased sensitivity to salt, and therefore they can get their blood pressures up. Now, hear me out. There is a genetic factors of early menopause, and there are factors that because of smoking and high blood pressure, you can get an early menopause. Early menopause can increase the risk of heart disease, while natural menopause has lower risk. The idea is to be proactive, healthy lifestyle changes in the midlife to mitigate the cardiovascular risk at menopause. Hormonal replacement therapy. Estrogen was used in the beginning. I have used it way back 20, 25, 30 years back because it was believed at that time that it was decrease of estrogen, and therefore we gave estrogen and we found there were more heart attacks. So estrogen should not be used to protect your heart. But estrogen replacement therapy for symptoms of menopause, if they are started early in the perimenopausal symptoms, they say that it helps. I don't advocate it, but please discuss with your doctors. Don't change any medications because harmful effects of estrogen are what? Stroke, breast cancer, uh, clots in your legs, a deep vein thrombosis, and cardiovascular disease. It is used for menopausal symptoms. It should not be used for perimenopausal. Use natural remedies. Phytoestrogen, naturally occurring compound found in plants that mimics estrogen in the body. Soybeans, flax seeds, sesame seeds, fruits, and vegetables. Mind-body techniques to reduce menopausal symptoms by reducing stress and improving mood. All this should be started earlier when you're young. And therefore, I come back to the treatment, the 6 pillars of lifestyle medicine. Healthful eating, we already talked about it. Increase your physical activity, especially in menopause. It has done wonders. And therefore, you should be doing at least 30 minutes a day of moderate intensity exercise at least 5 days in a week. Improve your sleep, 7 to 9 hours of restorative sleep. Develop strategies like to maintain stress, meditation, yoga, uh, religion, spirituality, what have you. Avoid risky substances, whether it is uh, street drugs or other, because I have known people who have taken Motrin, for example, ibuprofen, for years till they come to me with kidney problems or ulcers. And then avoid the smoking and drinking and form and maintain social relationships. It does make a big difference. As I found out in the blue zones, where people live to be 100, that social relationships and support is extremely important. So, my final thoughts on this. Women should be more aware that heart disease is the leading cause of death among them, surpassing all cancers combined. Spread the word. Recognize the subtle and vague symptoms of heart disease in women. Do not ignore the out of blue issues that I talked about. Women can experience heart attacks even without blockages in the major coronary arteries due to small vessel blockages. If a woman has a positive stress test, we talked about this, an angiogram is normal, but she still experiences shortness of breath and chest pain, you can do a coronary microvascular blockage is advised, testing for that. High blood pressure, diabetes, all this during pregnancy can increase the risk of future cardiovascular disease. So does menopause. And finally, it is important for women to ensure the symptoms are taken seriously by their doctors and to advocate for themselves more strongly. You're going to talk to your doctor. Do you think I need this test? Why am I getting this? I've used ibuprofen, Motrin, but the muscle pain is not going. You've got to be more assertive. And so, compared with women and to women, that women tend to have symptoms more often when resting or even during the sleep. And so we go on to a few things. We have got 2 more minutes. So here is cholesterol smashing drugs. what I found very important was a biodegradable stents. This is excellent. That keeps the arteries open long enough for medication and lifestyle changes to take place if you've got blockages. And then they dissolve. So they're not there. And finally, the coronary computed tomography and angiography, CCTA clearly. This is for evaluating your plaques to see the amount of plaque and the type of plaque. Hard plaques are relatively safe compared to soft plaques, which can rupture and cause an heart attack. With that, Debbie, I've kept my word, 40 minutes. Thank you very, very much.
Oh, Dr. Akil, this was so good. And let's see if you can take down your slides, and we're going to have you spotlighted here to answer questions. But that was really so specific. And Kathy and I had talked on the phone and said, we're just going to let you keep going because it was so good. And, you know, most of our audience are women, and we just did not want you to stop. But thank you for sticking to your 40 minutes. So I have two questions. First of all, when you began, you mentioned that troponin levels were lower in women, and so that sometimes can throw medical tests off. Can you explain that just a little bit further? And what would those lower levels be?
You see, I don't know exactly what the lower troponin levels are in women, but they're lower than in men.
Okay.
They're lower than in men. So if they rise, they don't even rise to a level which can be normal for men. So if they have a higher level going on, it's still normal because all the tests, like I said before, and all the other things are done with men in mind, not in women. So the exact troponin levels, the numbers, on top of my head, I cannot tell you, but I would come back to you with that.
Okay. So another question I had was, you talked about different tests that could be done. What about an echocardiogram? What can it show regarding your heart?
See, echocardiogram basically will show you a congestive heart failure or a heart failure. It shows ejection fraction of the heart.
Okay.
And that ejection fraction is very important because when you turn around and have an ejection fraction of less than 30 or so, that means you're in a severe cardiac failure. And you know, an interesting thing Dr. Dean Ornish has done. It was an observational study, though. But what he did was there were about 30 of his patients who were so badly off that they all needed, less than 30 ejection fraction. They had to have heart transplants. So they were waiting for heart transplants. And all these 30 people were put on a whole food plant-based SOS diet. And you know what? All of them improved their quality of life. And 5 of them did not need heart transplants.
Oh,
Such is the magic of. So when you're talking about echocardiogram, your cardiologist will do an echocardiogram to how your chambers are functioning. Whether you've got left ventricular hypertrophy, what are the pressures in the pulmonary artery, all that they can figure out.
okay. Well, we have a bunch of questions. I think Kathy is going to start with the questions.
Yeah.
Sure.
The first one that came up was AFib. Is there a way to stop it? Or if we have it, we have it? Like a whole food plant-based diet. Does that help?
Whole food plant-based diet will help in any situation that you are, period. But atrial fibrillation is a conduction problem. Like I have Wolff-Parkinson-White syndrome, which is a conduction problem. There's an accessory pathway. So if you have a pathway that is having this, now atrial fibrillation possibly has to be, and I love these new machines that they have, your watch, your Apple Watch and all that, can show your atrial fibrillation. Now, if your atrial fibrillation is not in a very rapid way, then too, you have to worry about it because it can lead to strokes or heart disease, coronary artery disease, especially strokes. So therefore, you have to maintain and you have to put the defibrillators the way it is to find out that now your heart is beating at a normal level and not going this way so that clots are being thrown all over.
Does estradiol post-menopause with persistent hot flashes and history of heart palpitations at age 70 increase risk of heart disease, including preconditions of previous bed rest and preterm pregnancies?
Yes. Short answer is yes. That person should not be taking estrogen, should look at the foodstuffs with phytoestrogens, look at meditation, sky breathing, yoga, what have you. But in my opinion, again, please do not change your medication till you talk with your doctors. But no, if you've had the past pregnancy history and you're having the hot flashes and you're getting your heartbeats going fast, I would not advise estrogen, period.
Okay, and another one is, what other screening tests are available to detect heart disease in women, especially those that would be typically covered by insurance for preventative measures?
See, the only ones which I happen to know, and these are also not done over here, for example, the CCT clearly test that shows a plaque. It's not being done. Only two of my patients had to go to New York to get it done. So the idea is that as far as I'm concerned, if you have calcium score, if you have a calcium score test, your echocardiogram, your angiogram, if your stress test is positive, getting a stress test, if you can do a physical stress test better than a chemical test, and if you can do a clearly test, these are all the tests that come to mind for a heart problem. But especially that microvessel, you can ask for it.
Okay, good.
That I talked about.
Yes.
That should be asked and told the doctor that, do you know? He may not know. There are a lot of doctors, cardiologists I've talked to. When I talk to clearly, they don't know. So even I
like that part about asking your doctor. You keep saying this is general advice, and this is a good place for you to go talk with your doctor. That's excellent. Thank you. I'm sorry to
Absolutely. There was a question over here, estradiol and estrogen. Yes, they are basically the same. What I would say, even if people are having hot flashes or they should go on a lowest dose if they have to with the doctor of estradiol or just the progesterone, if it can be helped. Of course, I'm not an OBGYN, but they can always talk to their doctors about it.
Yeah, having a conversation with your doctor is important. Okay, now
Absolutely.
one question is, would you say when you say plant-based diet, are you referring to exclusively to the Esselstyn diet, or can you allow avocado, olive oil, nuts, those things that aren't part of the reversal program?
I was not expecting a curveball question. Okay.
Well, let's get it.
Okay. The whole idea is, I'll put it this way, Dean Ornish and Esselstyn. Okay. Dean Ornish allows nuts, avocados, a bit of that. And I follow Dean Ornish because it is too stringent for me to follow Esselstyn's. But having said that, if somebody wants to totally reverse their coronary artery blockages, they should follow Esselstyn. And I'll tell you one other thing. When I talked about arteries, there were 50 million miles of arteries running in the body. So we are only talking about the coronary artery because it happens more often. But what happens if your arteries are blocked in your brain? You get stroke. What happens if they get into the leg? You get claudication and pain in your legs. What happens with kidney? You get kidney failure. And what happens with men who get it in the penile arteries? They get erectile dysfunction. And once they get erectile dysfunction for a 40, 50-year-old man, there are studies, research has been done that more likely than not in the next 5 years, they would get a coronary artery disease because penile arteries are smaller.
Well, we want to thank Ruth for sending you that curveball because that was an excellent answer. Okay. Debbie, did you see any that you wanted to pull up and talk?
Yes, there's a couple of them here. There are new EKG cards. They look like a credit card, and you hold them in the hand, and they're supposed to be able to do an EKG. Or do you think? Let's see. Right now, they are usually $99 for Heart Month. They're only $79. Do you think that's a good waste of money, or do you feel it's a waste of money or a good way to spend money?
I don't know, but you see, it helps in atrial fibrillation. It does not tell you you're getting a heart attack or not. It not gives you ST elevation and depressions and Q waves and all that. They don't give you.
Okay.
So the idea is that if you're using it for atrial fibrillation or conduction, sinus bradycardia, your heart is going slow, or your heart is sinus tachycardia, your heart is going fast, it is good.
Okay. So another question, what role does stress play in women's health? And what are a few stress reduction techniques that you would recommend?
See, let me tell you one small thing. Women carry a lot on their plate. The whole family depends on. My family depends on my wife. They hardly come and talk to me, but they'll talk to my wife. She is the main person. So she carries a lot on her shoulders. Now, if you look at stress, what are the main 4 points that gets you stressed? It is either you having a disease, or you are heavily in debt, or you are divorced, or there's a death. These are the 4 Ds. If you look at all these 4 Ds, you realize that this can cause a problem. And what problem? We are talking about an overstimulation of the sympathetic nervous system. I don't like to use this word, but I like to sort of use an analogy. Say, for example, you're driving a car, or say for somebody snatching your bag, and you are immediately trying to. This is fight or flee response. That means you're putting your foot on the gas pedal as fast as you can. And that is when your heart rate goes up, respiratory rate goes up, you start breathing much more. But once the episode is over, you take your foot off and put your foot on the brake pedal. Now everything comes back to normal. This is acute stress. This happens to everybody. But when this goes on every day, every week, every month, then you start getting cortisone levels increasing. Once your cortisone levels increase, the inflammation increases, you start eating more, you get more obese, your blood pressure, your diabetes, all that. So once we know that this is stress, now how do we settle this? There are ways and means to do it, right from physical therapy, psychotherapy, to medications, to other things, like, for example, yoga, meditation, like sky breathing. That's a wonderful technique. You can just go and Google it. All these things. So, and I always believe that when you are stressed and you are there, it is better to give support than to receive support. Because the moment your mind is this thing on giving support to somebody, you're forgetting your own problems. So it does help. So stressful situations do need a good counselor, a good psychotherapist, maybe medications at the end. But idea is that you have to learn to let go. You can only do that much. And are much better off when you take it on an even keel, when you don't go very high, very low. Accept it sometimes and move forward. We all have problems. I have stress. Yes, I have stress. The question is, everybody has stress. And stress was so big of a problem, all the CEOs and big guns would have been in a lunatic asylum. But they know how to handle stress. Handle your stress by the means I just told you and relax. What you can't change, accept it. I hope that answers.
I just saw a question and it disappeared. Oh,
This,
here it is. If an individual has one instance of bradycardia, I may have said that wrong, when experiencing an instance causing extreme stress, why are they labeled with this for the long term, even though never experiencing it again?
no. What you should do in that case, Debbie, for the person who has asked me, you should get a Holter done, 24 hours Holter or month Holter, and see if there are any bradycardia in that Holter so that you can catch it. If you don't have it, one episode, forget about it. But if you have a lot, then you should be worried about it.
Perfect. Okay, and then,
Debbie,
what-
I had a question.
okay,
And I know we rushed you with your slides, Dr. Keel, but that last slide you had that talked about new innovations in treatment of heart disease. The first one you talked about, and I pleaded ignorance. I did not know that there were stents that could dissolve, and there were some other things you said. Could you take one of those things that you think looks most promising and explain a little bit more about it? One of those new developments.
See, one is what you call as biodegradable stents.
Okay.
What happens is, whether which centers are using, I don't know. Are they being used? I don't know. But I know that these are the things that are coming in.
Okay.
Have they come already? I don't know. But what happens when you put these stents? Generally, stents remain in your body for life, medicated stents or otherwise. These stents keep your coronary artery dilated. But at the same time, once you start your lifestyle, and once you start eating better and sleeping better, and the 6 pillars of lifestyle medicine and your medications, then you do not need the stents now. So that you can start, your endothelium can start getting better and better and better. So the endothelium can heal and start producing nitric oxide. So you have a window period of, okay, now it is damaged, so we are having the stents. Then they dissolve after a while. And so other things take over. So you don't need the stents.
Mhm.
Now, there was Whelan had asked me a question, is what did she ask me? She said, I forget now, about what was it, Whelan? Can you please ask
Yes,
me?
thank you. It was, does ethnicity impact a woman's risk of developing heart disease?
Absolutely. African Americans, South Asians, we are at a greater risk of a heart disease. We South Asians have smaller coronaries. We have multiple vessel heart disease, multiple vessel coronary artery disease. We are more prone to getting diabetes. We have more low good cholesterol and very high triglycerides. So we are definitely, and so does the African American community. They have, because African American community has a very large listing of blood pressure, tremendous amount. But for all, if you follow, trust me, if you follow the 6 pillars, you're going to be in a safe place. There are things you can't change. I can't change my Wolff-Parkinson-White syndrome. I got LP little a, which has just been found because my cholesterol was not going down. I'm riddled with bad genetics. My brother died at the age of 52 of a massive stroke. My sister and my mother, they succumbed to heart disease at the age of 69. So things that are in our control, the so-called chronic diseases, blood pressure, diabetes, cholesterol, obesity, all these can be controlled, and we are not controlling it. And we are seeing people die, and we are looking at television screens, and we are seeing these huge, messy burgers and pork chops, and we're salivating.
I have a question that I don't think was addressed in your presentation. Can you talk about the importance of exercise, particularly as we get to be in our 60s and 70s?
Absolutely, ma'am. Lovely question, Vicky. When you are active, any sort of activity is better than no activity, correct? We all agree that. Now, there is a general activity and a purposeful activity. The general activity is walk in the park, playing golf. This is your general activity. Working in the garden, it helps. Your endorphins increase, and you calories don't lose calories, and that helps. But we want to talk about activity which is purposeful activity. And what is purposeful activity? Purposeful activity, your end result should be a healthy outcome if you have got a problem. Say, I've got a problem of blood pressure, I've got diabetes, I've got high cholesterol. I want to bring this down. Then, not the usual activity, purposeful activity. And what is a purposeful activity? Where your heart rate should go at least 70% of your maximum, even for a short period, short intervals. So first, in a purposeful activity, you should be doing 30 minutes of exercise a day for 5 days in a week, moderate intensity exercise. Now, it can be 10 minutes in a day, that's okay. But in that 10 minutes, at least 2, 3, 4 minutes, your heart rate should go 70% of your maximum. And people will ask me, how do you calculate? I've said this in a lot of my talks. I am 75 years old. So 70% of my maximum heart rate will be what? 220 minus 75. Correct? 220 minus my age. That will give me my maximum heart rate. 70%, so it will be 140, 145, like that will be my maximum heart rate. 70% of that will be 104, 105, 6, whatever. If I don't reach that, even short intervals, 1-2 minutes, and then go back to normal, then again 1 to 2 minutes, it will not going to help you. And remember, exercise does not only mean that cardio. Endurance is okay, biking, riding, swimming, all that. Parking your car way outside the supermarket and walking, that's all great. But the number 2 is what? Is muscle strengthening exercises. People lose their muscle, that is normal, because of hormones and because of inactivity as you get older. People rush to buy protein powders, not really required. Of course, you need more protein when you grow, but you can take beans and legumes. But the whole idea is to do muscle strengthening exercises, where your push-ups, wall push-ups, floor push-ups, whatever you have, so that your muscles are now getting more oxygen from the blood and maintaining your muscle size. And then you have stretching exercises. For some reason, we men are more stiff than women. So we cannot really, so what we need to do is stretching exercises. Yoga comes into play. And then finally you have is balance exercises for older people especially. A kind patient of mine once told me, and I want to repeat this, Dr. Taher, as long as you can put on your shoes without sitting down and standing up, both shoes, and tie your laces, your balance is okay. So That is all about. I hope I've answered your question, Vicky.
Yes, absolutely. Thank you.
Oh, Dr. Taher, this has been absolutely fabulous. And let's see, we are going to make you're on Spotlight.
I'll add you, Debbie.
Okay. Thanks, Vicky.
I haven't opened this.
Okay, yeah, it's that time now. Time for you to open that, please. But what I wanted to say to you is, we have speakers on every single month, and the difference, you just showed all of your passion. I mean, you demonstrate that every time I have ever heard you speak. You speak from the heart, and this is Heart Month, so it's always so appropriate. But I can't thank you enough. And that present that you're opening is just a small token of our appreciation. So please open it, and then I think Kathy's going to share what exactly it is.
Thank you, Kathy. Thank you, Vicky, and thank you, Debbie, so much for those kind words. I want people to understand, that's all. And my legacy should be that less people should get heart disease, Wow, it's a heart. And it's
Everybody needs one.
Wow, can you see this? Fabulous.
And that's filled with lavender. And it's one of those, like a pillow that you can heat up in the microwave and use it to warm yourself or work on a muscle or whatever. Or you can even put it in the freezer. But it's just lovely to hold against your chest and smell it too. So you're close to our heart.
Yeah, but the thing is, it won't belong to me. My wife will steal it from me.
We'll get her to let you borrow it now and then.
I know. Thank you so very much. Thank you so. Thank you.
Thank you.
Is we want to tell you what's coming up next. So I'm going to share my screen so you can see it. And this is the next event that will be in March, on March the 22nd. And I know you know who that face is. That's Debbie. She's going to be our speaker. And we're thrilled about this because it's Nutrition Month, which is exciting to think about what we know now can work with a whole food plant-based diet, thanks to Dr. Akil. And, Debbie comes with all kinds of qualifications to speak to us. Most importantly, I think, is she's a Food for Life instructor, and there are very few of those in our whole population. She was chosen to be trained by Physicians Committee for Responsible Medicine, and they don't pick you unless you're really top notch. Of course, she has those other qualifications as well, too. And she's going to help us, though, look at our plate and the colors on our plates and how those can bring to us some of those nutrients that Dr. Greger taught us about last month that can help our body as it starts wearing off and wearing down, And I think you'll find this is really, really helpful, whether you're 15 or you're 100. We can always use nutrients because that's what our body needs. And when you use color to find them, that's exciting. Now, Debbie, is there anything else that we need to say about that class that I missed on discussing?
Yeah, well, if you miss it, you're losing out. So be there.
Just please remind me also, I would like to join in this talk.
Awesome.
We'd love to have you.
We can actually just put you on our email list if you'd like, and then you'd know every time we have a monthly presentation.
No problems.
And anybody else that wants to join, and if you want to get our newsletter, you just send that address and email, and that will put you on our database so that you can get one of our monthly emails. So we want to thank everybody for coming, and especially Dr. Akil.